Hi, Carys.
Hello, how are you?
I'm very well, thank you. How are you?
Yeah, really good. Thank you very much. How's your week been?
My week's been really good, thank you. I think really glad that the rain has stopped. So I went for a really lovely autumnal walk earlier with my dog. It was just, such a relief to have some sunshine, looking very sort of autumnal. What about you?
Yeah, it's been wet. I got completely drenched through to the skin. But actually, sometimes I quite like walking in the rain. And my
Mm.
dog loves walking in the rain. She
Ah,
absolutely loves the smells. So we have different types of walk with sunny walks, with rainy walks. So yeah, I think you just have to have the right gear. That's the thing. You have to make sure. I did wear two raincoats, so it wasn't so bad. But yeah, I think in this country we've got to be used to it, haven't we? Um,
yes, yes.
and
Is
there's
that
also,
adage that there's no such thing as bad weather, just wrong clothing?
I think you're right. Yes, yeah. And it's quite uplifting, isn't it, sometimes,
Mm.
as long as you can get home to a nice warm cup of tea.
Yeah.
And we've had an interesting week, haven't we, in the menopause world with regards to the Panorama program, which we thought we would mention. We won't talk about it in detail,
Mm.
but just to say that we are still carrying on with our two doctors, Chat Menopause, and we want to provide evidence-based information, and that we are both accredited by the British Menopause Society, aren't we? So
Well, yeah.
we have our
Yes,
advanced
I've
certificate.
I've I've
Yeah,
completed my advanced
your
certificate,
advanced
and
certificate.
my accreditation is just in
Waiting.
progress, so that should be very soon.
Yeah. So those are the sorts of,
Mm.
that's the training and that's the evidence that we will be talking about and presenting. So just so
Yeah.
that people are aware of that, and that we can support you. And if you do have any questions or worries, please do go and talk to your doctor, just to make sure that what the regime that you're taking, if you're taking HRT, is right for you.
Yeah, absolutely. And today we wanted to talk about a really important topic that we see a lot in clinic, don't we? Which is sort of the mental health and mood changes that occur, particularly in perimenopause, and also in postmenopause for some women. And I don't know about you, but we know that there's a huge variety of mood changes that women experience. And do you want to sort of share a little bit about the really common ones that we see in clinic with women coming in with?
Yeah, absolutely. I think this is possibly the most
Mm.
common symptom I see. So when hormones change in perimenopause, as we have I'll show you here, our sort of really big storm of up and down hormones that
Mm.
can happen, then we can find things change in our body, but also in with our emotions. And I find people, 25% of people don't get any symptoms, do they? So they
Mm.
will come through without any symptoms. About 75% of us will get symptoms, and about 25% of those may be symptoms that can affect our quality of life quite significantly. So, what we want to say is that although we'll talk about the mental health and the emotional changes that can happen when the hormones change, not everybody will get this, but some people may.
Mm.
And the things we see are potentially anxiety. And these can be, so there are two types of things to discuss here. So, it may be that you have had a history of mental health problems in the past, a diagnosis, and that could become worse around the time of hormonal change in perimenopause and menopause. Or it could be that you've never suffered any mental health or emotional problem at all, and suddenly you start to suffer these new symptoms. So it could be anxiety, like anxiety of driving is a common one, isn't it?
Mm.
Or it could be that you suddenly don't want to do a presentation that you were usually you find it fine to speak in public, but actually doing that now makes you feel really nervous beforehand. It could be your mood is low. You just feel very
Mm.
flat and you don't have that joy that you used to experience in things that would usually bring you pleasure, like your hobbies or spending time with people that you really like. It could be that your mood is high and low, and you're sometimes feeling joy and then you're not, and it comes and goes, and you wake up and you're not quite sure what you're waking up to. Sometimes people feel they wake in the night, they might have anxiety, it might cause them to wake with a feeling of dread, or a feeling of impending doom, or
Mm.
something like that that could come with anxiety. Irritability is another one. I find
Yeah.
that people, we become much less tolerant, and people will often explain that they might be less tolerant with their family, their friends, or at work. There may be these, some people feel quite agitated with the change in hormones, and sometimes there is this outburst of rage. And today somebody's described it quite perfectly, where it just comes from nowhere. And then she feels very upset and tearful afterwards. And we're not sometimes even sure why it's happening, or what it is that we're suddenly become angry about. But those sorts of emotions can be really difficult to control because
Mm.
they come out of nowhere. Worrying and maybe anxiety can make you work longer at work because you're worrying about making a mistake, for example. So we may have all these differences in our mental health and our emotional health, and also difficulty concentrating is one, isn't it? So it's quite hard to focus, and you might suddenly find yourself thinking, gosh, I'm not sure what I'm doing here, or I've lost my train of thought, or I used to be really good at multitasking, and now I find I really need to focus to keep going with what I'm trying to do, and use different coping strategies for that. Premenstrual syndrome can worsen in PMDD. We're going to discuss this at a different one, aren't we? Because
Yeah.
it's quite a big topic. There's a lot we want to help you with. So, so if we could talk about that at a different one chat, then I think that would be really good. And of course, we have to say some people really feel very low at this point, and it could be that you start to have thoughts about self-harm or suicide. And if that is happening to you, please keep watching, because we have got some advice that we will give you, and certainly some links to help with this. So I think those are the things that we might see. Have I forgotten anything?
No, I think that's sort of the main sort of overview of things that we see. And I think it's important to say it can be really disorientating for patients, can't it? For people if they start experiencing these things that they've not necessarily experienced before, or if they have had depression or anxiety in the past, and this suddenly feels very different to how they've experienced it previously. It can be quite sort of destabilizing and difficult to sort of understand for women, particularly if they're not necessarily already aware that they're perimenopausal. It's difficult to put a rationale to why these things are happening. And often, I don't know about you, but I often see women sort of putting things down to, being very busy at work, or, the stress of navigating family. And it's really difficult to unpick, is this a stress related problem sometimes because I'm under lots of pressure? Is it my hormones? Is it something else? And I suppose that's one of the benefits, or reasons why it's really important, particularly if things are really affecting people, to discuss with a doctor or a professional, just to help sort of unpick what might be going on, what else could be going on, because that can sometimes cause people because they're not sure what's happening. They feel like they should be coping, they shouldn't be getting angry with people, to sort of try and keep it all inside and feel like it's something to do with them, whereas actually so important to discuss with people, because in general practice we see a whole host of mood changes and mood problems, don't we? So it's something we're used to supporting people through. I don't, we mentioned that anxiety is really, really common at this sort of stage of life because of those hormonal fluctuations. How would you describe anxiety to someone who's never had it before? I can't think that there's anyone who's maybe not had any anxiety
It's
before.
It's really common, isn't it? Well, I suppose it's so it's the word we use to describe that unpleasant feeling when we're under threat, isn't it?
Mm.
So most of us will have it at some point in our lives. As you say, it'd be really unusual for us not to experience that thought. And it's a really normal thing, like a
Yeah.
protective thing, isn't it? So imagine if you're out on, you're living on the savannah, and there is the threat of an animal, about to pounce, you'll have that feeling of anxiety, won't you? And
Mm,
that's normal, because that's going to keep you alive. That's going to help you rise your blood pressure a little bit. It's going to help your breathing rate go up. You'll become more hypervigilant. Your blood sugar will go up,
mm,
ready to fight the lion or run away. So that's your response to a perceived threat. So the things that you might find are, you might have palpitations, you might find you feel a little bit sick. You could get a little bit of chest pain in some cases. Your breathing goes up. You might feel a bit dizzy. You may, and if that is happening to you a lot, then it can be quite debilitating. It's all right if it's
mm,
happening to you because you're trying to get rid of something or trying to get away from something. But if it's happening to you a lot, then it can be really difficult to function, and it can help you. It can cause you to wake in the night, for example. And I always describe it like somebody's got like a little lion, a big lion, ready to pounce. You're constantly ready, thinking, when's it coming? So it's very hard to sleep or even to eat.
mm,
So if your sympathetic nervous system is ready to run, then how do you get back to your parasympathetic nervous system, where you're by the campfire, you are resting, you're eating, the blood is now going back to your gut more so that you're able to digest food more easily? How do we change those physiological changes that help us survive into the physiological changes that help us digest and rest? So it's an interesting thing, isn't it? And often we're
mm,
maybe not aware about it. How do we use maybe our breathing to do
yeah.
that, or what do we do that can help us? So
Yeah, there's
what would you
lots
say?
of things. Yeah, there's lots of things that we can use in the moment to help with that. Obviously, I'm a big advocate of yoga, relaxation techniques that people can learn quickly. Spending, having people that you enjoy spending time with, activities that you can do. There's cognitive behavioral techniques that people can learn. Often or sometimes that isn't enough though, is it? And sometimes we see women who might be doing all of those things which are really helpful, but there's also other things that need to take place from a lifestyle perspective, like exercising regularly, eating well regularly,
Yeah.
having, looking at managing how stress can be managed more effectively, getting support from people around you. But sometimes for some people that isn't sufficient, is it? And some people still continue to experience lots of anxiety based symptoms, or some of the other mood changes that we mentioned, the irritability, that feeling very sort of, we call it sort of emotional lability, don't we, where sort of things are very up and down. It's difficult to control your emotions, which can be disorientating and difficult in like the workplace or with family. And I wonder if we're thinking about in terms of what might help these things, I wonder if it's helpful for us to talk a little bit about why these happen in perimenopause in terms of
It's a good
the
time to share my thing.
estrogen and progesterone. Yes. So we
Yes.
know, obviously, we've talked, haven't we, before, about how the estrogen's declining in perimenopause, but there's also lots of peaks and troughs. And I know you've got your amazing diagram, because estrogen impacts our serotonin, it impacts our dopamine levels, so it can really sort of cause lots of changes in those neurotransmitters. And I know
Yeah.
this is something you're
This
really
here.
interested
Yeah.
in, isn't it?
I love our I love looking at things in a bigger picture, as we both do, don't we? So I think this is really helpful, and I found it really interesting. So estrogen modulates our neurotransmitters. And what's a neurotransmitter? It's like a chemical message that happens in the brain that sends a message from one neuron to another. And some of the ones that people may have heard of are serotonin, which is known as our happy hormone, which strangely, I was talking to my son about this, 90% of this is made in the gut. He couldn't believe it. I keep going on about gut health, but he was really really interested that that was the case. So 90% of our serotonin is made in the gut. So that's actually a big area to concentrate on if mood is difficult. So serotonin is one. Glutamate is one that helps us concentrate. So if we're having that problem where we can't focus on things, then estrogen has an effect upon that, has an effect upon dopamine, which is great. Dopamine is really good if it's in the right balance, but we don't want too little, and we also don't want too much. So if we think here, so I'm going to just show this. This is from Life Code GX, which looks at your own genetics and how your nutrition can impact your own genes. So for example, if you're looking at tryptophan, so that's an amino acid that you can get from eating some types of food. We want to make that into serotonin, which is our happy hormone. And further down here, we want to make it into melatonin. We don't want it stealing across this pathway here. So what's going to help us make tryptophan into serotonin? So estrogen is one of the things. But also we have other things, and these are things which I've seen in clinic today, actually. So vitamin D. So today I saw somebody with a very, very low vitamin D, which is important in this pathway. So it's important to make sure that's optimal. And I'm talking about diet. I'm not recommending big doses of supplements because this is dietary that we're going to try and look at. Some people do need supplements, and certainly vitamin D may be one, but when I'm talking about these, I'm talking about trying to get them in the diet. Iron is another. So if you've got really heavy periods in perimenopause, which is quite common, maybe you could be low in iron, which needs to be looked at. What about your folate and vitamin B, your methylation pathways? These also help that. Zinc, magnesium, vitamin Bs will also help the tryptophan come down to serotonin. Then these here are going to help the sensitivity. So once you've got your serotonin in your synapse, how sensitive are your receptors to it? Are they very sensitive? So only a teeny bit is going to making you feel really like you've got a lot of serotonin. Or are they really dialed down? So you're needing almost more serotonin to help to make them work properly. That's genetic, actually. And then we wanted to come down to melatonin, which is your sleepy hormone. So what's going to steal it away in this pathway here? So we've got cortisol, stress. One of our stress hormones is going to do that. And also inflammation, so which we can get from being unwell in our body, or we can get from foods that we might eat or carrying extra body weight. So omega-3 is something that keeps it in the tryptophan line. Estrogen also does that as well, and it affects the sensitivity of the receptors, and it affects how we get rid of our serotonin. So estrogen has a role there. So you can imagine if your estrogen is up and down and up and down, you don't know where you are. And so this is only one example of the pathways that I could show you. I find it really interesting, and it shows me that actually it's a big picture, isn't it? So we can use, so we could talk about treatments now if we're talking about hormone replacement therapy, for example. So if we're going to talk about mood changes in perimenopause and menopause, what do we think is the treatment that is advised by NICE guidance? So we're looking at hormone replacement therapy, if that's possible to take, and cognitive behavioural therapy as well, aren't we? Which I'm also a huge fan of. I did a course on it, the British Menopause Society course, and I wished I had done it years ago when I was, a young woman, because actually I thought it was amazing. And it really taught me how my thoughts work and how that is impacting my behaviour. And it was really, really good. And they do not advise the use of antidepressants for those mood changes in perimenopause and menopause, and but some people do need to have antidepressants for treatment of depression, and it can be used alongside hormone replacement therapy. So we'll talk about this in a way in which is general, but obviously there are some people that really do require to be antidepressants for their treatment, and that is absolutely right for them. And I have got patients who are on both treatments, and that's right for them. So hormone replacement therapy can help sort of by adding in those hormones when they're a little bit low, can't they? But in perimenopause, it don't necessarily give you stability adding hormone replacement therapy, does it? So we can talk about ways of using hormone replacement therapy, and also of potentially using the combined contraceptive pill at this time, remembering that there
Yeah.
are now those 3 types of estrogen in combined contraceptive pills: ethinyl estradiol, and your new types of contraception pill with the estradiol and estetrol. So there
Yeah.
are ways of using. So when we use hormone replacement therapy, for some people that could be estrogen in a gel, patch, spray, or tablet, or implant, but not usually as much, and a progesterone if you have a womb, or progestogen, a synthetic progestogen. Or it could be a type of contraceptive pill to give stability as well. It's a discussion, isn't it? So about what will work best depending on how old you are, what your contraceptive needs are, whether you have premenstrual syndrome or PMDD. So just so that we can talk about the options that are available, they would be in our toolbox for some people, wouldn't they, if there were no contraindications?
Yeah, absolutely. And I think the key thing here is that there's no one size fits all, is that, different people will need different treatments. And, as you mentioned, the NICE guidance, suggests that we shouldn't be using antidepressants for treatment of hormonal perimenopausal mood changes, but for some people, that might be absolutely right for them. And, I think the other thing to say is sometimes I have people thinking that it's either cognitive behavioral therapy or HRT, or it's either one thing or another, and often it's not necessarily that you have to have one at a time. You can use both together. I've had quite a few patients who using sort of both HRT, cognitive behavioral therapy, and some lifestyle changes,
Yeah.
all working together. It can take time, can't it? If we're thinking about, if you start HRT, we know it's not an overnight fix or cure. And sometimes if people have been feeling like this for a long time, they're, because of their hormonal changes, their thinking patterns, if we're talking about anxiety, can just become very anxiety focused. We may have all experienced this ourselves. If you start spending a lot of time worrying about something, your brain will then automatically have a lot of those worries, even when the hormone levels are replaced or things are a lot better. So I often think we do really need to think about, not just the hormones, not just the lifestyle and sort of the environment that we're in, because our brains are so sensitive to our environment and what's going on in it. And I think when we're in these times of hormonal flux, that sensitivity increases even more, doesn't it? But also that psychological piece, and signposting people to appropriate services and professionals that can help with that can really help people to feel supported and feel, experience the benefits that they're experiencing. I think the other thing you alluded to earlier, didn't you, about sort of the impact on relationships, which I think can be such a important topic when we're talking about mood changes, because if people are, feeling very irritable or very low, it means that they're not necessarily able to interact in their relationships in the same way that they would have done previously. And sometimes that can cause conflict. It can cause people to feel more distant from one another. People can end up isolating themselves, can't they? Or not wanting to see friends as much, or not wanting to spend time with their partner. And it can sometimes mean that it's very difficult for the person supporting, a woman
Yeah.
experiencing these mood changes. And it can all become a little bit of a
A vicious cycle.
yes, and
And sometimes people turn to alcohol at this point,
yeah.
don't they, to try and help. Why do you think they do that?
I mean, I
Very
think it's
interesting.
I think it's really, really understandable. I think it makes a lot of sense because we know that alcohol binds to those GABA receptors,
Yeah,
and GABA is one of those calming hormones.
exactly.
Over, simplified version, but that helps them to feel calmer. I suppose, because we know our levels of progesterone are declining in
Yeah,
perimenopause as well, and we're all very different, and some people will have different reactions to progesterone, but lots of women find that decline in progesterone can sometimes increase anxiety. And so alcohol can serve a really useful
Yes.
function, but ultimately it isn't helpful,
Stops
is
you
it?
sleeping.
And it
No.
stops you sleeping, you feel worse the next day because you
Yeah.
then sort of, the GABA receptors get really upset that there's no more alcohol there, and then it all just can really
Everything's.
impact on things. Yeah. And then I
I
suppose that's the
agree.
other thing, isn't it? That sleep and impact has a huge knock-on effect on mood. um it is, like you mentioned, that vicious cycle. And I think, not being too negative, because actually, if it is, we're using in that negative cycle, that can be a really positive cycle as well, so that small changes, things along the way, can actually help people to see those small stepwise improvements over a period of time.
Yes,
I don't know if that's
you're
something you
so
find.
right.
You see that in your patients as well.
I think definitely, and I think if we're looking at particularly at lifestyle, so I love the GABA receptors. Thank you for mentioning that. It's one of my favorite things. Is we know that progesterone that we make in our own body is good for anxiety, anti-anxiety, anti-low mood, neuroprotective. And so it's metabolized down to allopregnanolone, which attaches to those GABA receptors, and many people like that, but not everybody gets on well with it. Some people are sensitive to their own hormones, and the alcohol can be used in order to reduce anxiety initially, but then it affects your rapid eye movement, sleep, and leaves you with feeling emotional and tired the next day, and often hungry. And Other things that you can do to help your GABA receptor, things like lemon balm. So lemon balm tea will help to slow down the breakdown of GABA. Rosemary, also really nice to use in order to help calm. So what we want to do is, we've got these stimulatory neurotransmitters like the glutamate, and we want to make sure that we have enough time to induce our GABA, to make sure that we're not putting the wrong things on the receptors like alcohol, that we're making sure there's plenty of space for the progesterone or the other things that stimulate GABA, and that we're looking at nutrition, particularly with lots of vitamins and minerals to help do that as well. And I think it's one thing I think is really interesting, having lived through this type of thing, which affected me, I think, the most, was it definitely is a journey that you experience through it. And the things that I think would have helped me most would have been, this is not going to be like this forever, because you don't know when things change,
Mm,
how things will experience you. And actually, there are some really helpful things that you can do. Breathing exercises were actually the things that I really found so helpful. And actually, if you start to practice them, then they come in before you start to feel anxious, almost. Your body realizes that you're starting to feel a bit anxious, and you start to bring the breathing exercises in, and those are really, really useful. And also that sometimes things will be worse than others, but it won't be the same every day. But actually, you turn to, I'm a big fan, and I know you are, of spending time walking. We've both got dogs, haven't we? And
mm,
spending time in nature, I find it enormously healing. So getting outside, really prioritizing that sleep. So not watching the Netflix till 2 a.m. Getting up at a regular time, having that morning sunshine on the skin, really eating well, looking after your gut microbiome like it's the most precious thing you have, because actually, if you feed that well, that's going to be helpful. Keeping your blood sugar stable, exercising, but not. What do you think about exercising? I think some people turn to a lot of exercising, and that's a really good point. I sometimes have people who run a lot, do lots of
mm.
HIIT, do lots of cortisol inducing type of exercise. And But they need that for their mental health, yet it might not be serving them well. What do you think?
Yes, I think we know. I think it is a fine balance. I suppose what we know is that it, lots of cardiovascular exercise, or high intensity exercise in perimenopause, when your hormones are up and down, sometimes might not necessarily be the right thing for people, because we just, like you say, we're just increasing that cortisol, and impacting on how the body's processing progesterone, pregnenolone. It can impact on sleep, and actually sometimes perimenopause can be a really good time to focus instead on less high intensity exercise, things that are more soothing and gentle for the body, and also great time for weight training and resistance training, isn't it? Which you know is so
Yeah.
important for bones. I think we could talk about this for until the cows come home, couldn't we, Carys? I know
Mhm.
we're both big
We had
advocates
we had
of
more we
lifestyle.
had more on the list, but I think
I'm
actually
really,
we don't want to make it too long. But I think we've done really well. We've talked about the things that can happen. We've
yeah.
talked about the lifestyle things that we can use. We've talked about adding hormone replacement therapy or another type of hormonal treatment. We've talked about CBT and how that can be used as well. And we've talked about nature, mindfulness meditation. People often think of those as big words, but actually, I often describe it as calming the brain.
Mm,
So finding a time where your brain is resting and is calm every day is helpful. And another thing, talking to people as well, explaining, look, I at a time when you are calm, this is how I'm feeling. I don't know where this comes from sometimes. I need you to be like this. I need you to learn how to read about the things that could be happening to me. And I need us all as a family to work together so that when it does happen, we all have a plan of action as much as is possible to try and make sure it's supported well.
mm,
I think that's often helpful. And if you're listening and you're someone who is actually listening on behalf of somebody that know and love and who's really struggling, then we will put some links in the notes on some websites that you can look at. And by all means, make an appointment with your GP or obviously with one of us at Rowena Health. We're very happy to support people with this because we see this a lot, and we know that there are things that we can really help. And actually, exactly what you said, the very small changes can make such a
mm.
big difference. And I've seen people totally turn around their mood changes in premenstrual syndrome through looking at all the lifestyle things that they were doing and really changing things, and so positively. It was really wonderful to hear that. So there are lots of things that we can support you with.
Yeah, absolutely. And I think, yeah, like you say, the key thing is that, you know, do reach out for that help and support, because there is lots of it available. Somebody asked a question about, or mentioned that it must be very difficult ascertaining the difference between sort of normal depression and anxiety and hormonal changes. And I suppose
Yeah.
we won't go into that in a lot of detail, but I suppose we have sort of screening questionnaires and tests that we can use to help us ascertain that as doctors. So your GP might use something called the PHQ-9, which helps to assess and quantify levels of depression. There's also something called the GAD-7 questionnaire, and then we also have the MENO-D questionnaire, which looks at depression, menopausal depression, perimenopausal depression. It's not validated for use, but it can. I don't know about you, Carys, but I find that sometimes helpful just to think through when
Yeah,
I'm
it's
with
it's
somebody.
just it's this one here. There's a lot of questions on it, but really, really helpful. And you can just search that yourself and have a look and see, because it is really difficult sometimes to say that is this depression, which we now would gauge as mild, moderate, or severe, and we would treat accordingly, or is it the lows, the mood fluctuations that we see in perimenopause and menopause? So it can be difficult to that's not true. It just takes time to discuss it fully, and maybe for you to track your symptoms and really think about how you're feeling and how long it's lasting. Because if the symptoms are really leaving you feeling very low every day for more than a couple of weeks, then that's the time when we'd start to say, okay, well, your mood isn't lifting. We need to think about what could that be. Could it be, and we should probably mention maybe some blood tests like thyroid disorder, for example, that may need to be done. So that's definitely something to reach out, and it's a big topic.
Yeah, yeah. And we mentioned earlier about those sort of resources that people can have a look at. So we'll pop some of them
Yeah.
in our stories, won't we, Carys? I suppose the
Yeah.
thing to say is, if anybody's listening to this and feeling like they're really struggling with their mood, they're having any thoughts that might be worrying them, thoughts about suicide or self-harm, you can always contact 111 or the Samaritans on 116 123. There is always somebody there to talk, isn't there? And I know that sounds quite, for some people listening, that might sound very sort of serious and extreme, but I think it's just important to say, because there is a huge variety of experience in these mood changes that we see, aren't they? You know, and they can be relatively mild for some people, but still having a significant impact on their functioning and quality of life. So just because they are, you know, it's just, some people might say it's just some irritability, it's still definitely important to reach out and, you know, consider what those options might be, even if you're not somebody that's wanting to consider hormone replacement therapy, or you can't have that for whatever reason. There's, you know, your doctor will be able to discuss potential options for you, and certainly signpost to other services from a, you know, CBT or psychology perspective as well.
Definitely.
So is there anything else we need to say at this point, Carys? Is there anything else
No, I think
we need to say before we close?
I think we've covered everything we really wanted to. It's a really big topic, isn't it? And we will talk further about premenstrual syndrome and PMDD, as we said, and we'll talk also as another session about the cognitive changes, won't we? The and the memory changes that
Brain
often
fog.
cause, those sorts of things. So those are definitely coming in part 3 and 4.
Yes, and if anyone's got any requests for topics for us to discuss, then we're, you know, very, very open to hearing those. You know, we want to make these as useful and informative as possible. So yeah, please do let us know if you've got any requests.
Absolutely. Lovely to see you. Have we
Perfect.
got Ona?
Thank you very much. And just to say as well, you know, as Carys alluded to at the beginning, this isn't intended as any personal medical advice. We're sort of providing sort of general information. So please do speak to your own doctor if you've got any concerns or questions.
Yeah, absolutely. Okay.
Cool.
Thank you everyone
Well,
for
thank you,
watching.
And
And
thank
so
you,
nice to see
everyone.
you, Rachel. All
Yes.
right. See you
Have
soon.
a lovely
Take
evening.
care.
Bye-bye.
Bye.
Bye.
Bye.